Welcome back to PNB Wellness Academy. Today we're continuing our mood stabilizer review with two anticonvulsants you need to recognize for the PMHNP boards: Valproate, commonly known as Depakote, and Lamotrigine, commonly known as Lamictal. Although both medications can be used in bipolar disorder, their roles are different. The easiest way to separate them is to remember that Depakote is strongly associated with the treatment of mania, while Lamotrigine is associated with bipolar maintenance, particularly the prevention of depressive episodes. Let's break down the high-yield differences. Depakote is an anticonvulsant that also functions as a mood stabilizer. For the boards, associate Depakote with acute mania and maintenance treatment of bipolar disorder. Its benefit for acute bipolar depression is much more limited. Depakote decreases neuronal excitability through multiple mechanisms, including increased GABA activity and affecting voltage-gated sodium channels. You don't need to overcomplicate the mechanism. The important connection is increased GABA activity, sodium channel effects, and decreased neuronal excitability. Depakote can cause common adverse effects such as nausea and other GI symptoms, sedation, tremor, weight gain, and hair loss. However, the serious adverse effects are much more important for board questions. Remember 3 words: liver, pancreas, and platelets. Depakote can cause liver toxicity, pancreatitis, and thrombocytopenia. If a patient taking Depakote develops significant abdominal pain with nausea and vomiting, consider pancreatitis. If the patient develops unusual bruising or bleeding, think about thrombocytopenia. And signs of liver dysfunction should raise concern for liver toxicity. Because of these risks, patients taking Depakote require appropriate monitoring. Remember liver function tests for liver toxicity, a CBC with platelets for thrombocytopenia, and a Valproate serum levels when therapeutic drug monitoring is indicated. Pregnancy status should also be assessed when applicable. If symptoms such as pancreatitis, evaluate for pancreatitis. Another important complication is hyperammonemia. If a patient taking Valproate develops otherwise unexplained lethargy, vomiting, confusion, and altered mental status, think about hyperammonemia and consider an ammonia level. Pregnancy is another major Depakote board topic. Valproate is highly teratogenic and should generally be avoided during pregnancy for bipolar disorder when safer alternatives are appropriate. The classic board association is neural tube defects, like spina bifida. This gives you an important comparison with lithium. When you think lithium in pregnancy, you want to remember the association Epstein anomaly. When you think Valproate in pregnancy, remember neural tube defects. Now let's move to Lamotrigine or Lamictal. Lamotrigine is also an anticonvulsant used as a mood stabilizer. But don't confuse its role with Depakote. Lamotrigine is particularly useful for maintenance treatment of bipolar disorder, especially prevention of depressive episodes. It is not an effective primary treatment for acute mania. So if a board question emphasizes acute mania, Lamotrigine should not be your first association. If the question emphasizes bipolar maintenance and prevention of depressive episodes, Lamotrigine should move much higher on your list. Lamotrigine primarily blocks voltage-sensitive sodium channels and decreases the release of excitatory neurotransmitters such as glutamate. So let's remember, sodium channel blockade leads to decreased glutamate release. The adverse effect you absolutely cannot forget with Lamotrigine is a serious rash, particularly Stevens-Johnson syndrome and toxic epidermal necrolysis. This is why Lamotrigine must be started at a low dose and titrated slowly. Remember the phrase, start low and go slow. Rapid titration and excessive starting doses increase the risk of serious skin reactions. A patient taking Lamotrigine should be educated to report a new rash promptly. A concerning rash accompanied by blistering, pilling, mucosal involvement, fever, facial swelling, or systemic illness requires urgent evaluation for a severe cutaneous reaction. For board questions, if a patient recently started Lamotrigine and develops a concerning rash, think Stevens-Johnson syndrome and recognize that the medication should not simply be continued without evaluation. There is also an important interaction between Depakote and Lamotrigine. Valproate inhibits Lamotrigine metabolism, which increases Lamotrigine concentration and increases the risk of serious rash. Therefore, when Lamotrigine is given with Valproate, Lamotrigine must be started at lower doses and titrated even more slowly. For the boards, make the connection. Valproate increases Lamotrigine exposure, which increases the risk of rash and Stevens-Johnson syndrome. Another useful Lamotrigine pearl involves mistreatment. If Lamotrigine has been discontinued for a sufficient period, the patient may need to restart the titration rather than simply returning to the previous maintenance dose. The exact approach depends on how long the medication has been interrupted and other interacting medications, but the board concept is straightforward. After a significant interruption, think retitration because restarting too rapidly can increase the risk of serious rash. Other possible Lamotrigine adverse effects include headache, dizziness, nausea, blurry or double vision, coordination problems, but Stevens-Johnson syndrome is the major association you need to remember. Routine serum Lamotrigine levels are generally not required for standard bipolar treatment, so your monitoring emphasis should be on clinical response, adherence, drug interactions, and especially the development of rash. Before we finish, make the differences automatic. Depakote means acute mania and maintenance. Think liver, pancreas, platelets, hyperammonemia, and neural tube defects. Lamotrigine means bipolar maintenance with prevention of depressive episodes. Think start low, titrate slowly, serious rash, Stevens-Johnson syndrome, and the interaction with Valproate. If you recognize those differences quickly, you will be in much better position to work through PMHNP board questions. Thank you for learning with PMB Wellness Academy. Save this review so you can come back to these high-yield connections and subscribe for more PMHNP board prep made simple. I'll see you in the next review.